Hi everyone, this is Alex again, and today we're going to be talking about celiac disease. So, this is actually a topic that was chosen by one of our patients. They want to hear more about celiac disease. So, I don't claim to be a specialist, I'm not a gastroenterologist. However, Dr. Young and I, we do see patients with celiac disease and a lot of patients with the gluten intolerance. It's a real thing going on these days. But celiac is interesting because it's a diagnosis that we've known for a long time. And way back when I was in school, what I've learned about celiac was very little. And all I knew was that people were diagnosed when they were young and they had those abdominal distension, malabsorption, irritability. And these kids were like crying. They failed to thrive. And looks like they were born like that. And some of those kids were put on a banana diet and they would be okay. So it was discovered it was caused by gluten. So gluten seemed to be the trigger for this celiac disease. So the question comes, okay, so what is celiac disease exactly? It's an autoimmune disease. Okay, it's an autoimmune disease, meaning that gluten seemed to be the trigger. Okay, meaning people eat gluten and then they have a reaction, an autoimmune response to the gluten that they're eating. And as a consequence, you see that their gut becomes inflamed, and this is a result of the gluten. So this is a normal gut. The way you see there, the villi is these like finger-like formations that increases the absorption of nutrients in your gut. And once you trigger an autoimmune response, meaning your body fighting your own self, then you start seeing this flattened surface in the gut lining, which is a problem because it lowers the absorption of nutrients a lot. So when people with celiac, okay, you don't know if you have celiac or not. Used to be that the patients were diagnosed when they were kids. Now we see the diagnosis being made when people are in their 50s, in their 60s, even in their 80s. I have seen it. Adults, like I said, I don't see children. In practice, I see adults, but I have seen patients, older patients, being diagnosed with this disease. And it's very concerning because they can be having this problem for a long time and it's undiagnosed. So, and this is the problem. So it's a multi-system disease in which the villi of the small intestines start to be damaged. And then as you can see in this picture, that's what happens. So it's caused by gluten. So that's the main definition. And what is gluten? Gluten is a protein from the wheat. It's in wheat. It is a protein. So wheat has this protein called gluten that is believed to trigger the celiac problem. But as you can see in my picture here, I have all the grains here. They all come from the grass family. And we always say celiac should be gluten-free, which means, they should stay away from wheat, rye, and barley. And a lot of celiac patients, they still eat gluten-free, meaning sometimes they eat rice, sometimes they eat even oats. It's considered to be safe in conventional medicine. Corn is considered to be safe. So a lot of gluten products have these other grains in them. And my question is, although conventional medicine states that only wheat, rye, and barley seem to be the problem, my question is, all the other grains that belong to the grass family, they also have another protein called gliadin. And I wonder if that's still a problem for some people that have been diagnosed with celiac disease these days, and especially if they are diagnosed later in life. The symptoms of celiac, how do you know you have celiac? You don't know. Let's say, let's talk about a situation with an adult person in their 30s, 40s, 50s, and weight loss, not very common. Actually, I don't see weight loss being an issue, but I do see fatigue, anemia, iron deficiency anemia, B12 deficiency, a lot of bloating, diarrhea sometimes, but constipation, abdominal pain. Abdominal pain can be a big issue with celiac. They actually can be in a lot of pain. Um, and nausea. They have joint pain. Joint pain, we see that a lot. Muscle pain, seizures can be another problem. Dermatitis herpetiformis. It's a rash. It's if you actually look it up, the gluten rash. It's the celiac rash. If you have that and you have been diagnosed by a dermatologist, that means you have celiac disease. You don't actually have to go through all the process of diagnosis. You need to be seen by gastroenterologist to follow up with your gut problems. But if you have that rash, it's likely that you have celiac disease. It's actually considered one of the diagnosis. Hair loss, of course, because you have malabsorption. Canker sores. You see canker sores even with gastritis or GERD, the acid reflux, but you can see canker sores with celiac. Burning of the tongue, infertility, miscarriages. You see, that's not just related to abdominal symptoms. It's kind of like a multi-system disease. That's why they call it multi-system disease, because you can have other symptoms. Oh, you have celiac and you off gluten and you have no more symptoms. Is it that simple? Sometimes it's not. Sometimes you can have, you no longer have diarrhea, but you might have other remaining symptoms that we need to pay attention. So those are the most common symptoms when it comes to celiac. Here's 2 pictures to show you the rash that I mentioned. The picture here to your left, actually, I have seen this in practice in an older patient, dermatitis herpetiformis. I actually have seen that. This one to your right here, I have seen that also in clinical practice. So if you see a rash, I think, a skin rash, you should go be seen by a dermatologist and rule that out. Make sure that that's not dermatitis herpetiformis, because if it is, then, like I said, you need to look into, and that's interesting to see how a gut problem show up as a skin problem. Okay, so got to treat the gut, right? Got to treat the gut. It's celiac, yes, but it's still have to treat the gut. So how do we diagnose? How do you know if you have celiac disease, not just a gluten intolerance? So that's a big problem. That's a big issue that people need to know. Why is this so important? Why is it important for you to be diagnosed if you have this condition? It's important because if you've been eating gluten and you feel uncomfortable and you have symptoms and you stop eating gluten and you feel better, by the time you get to your doctor and you say, well, I was having issues when I was eating gluten, so now I'm not eating gluten, I feel better, we can't test you blood test wise, because the blood test will show up negative because you've been off gluten. So it's important to be tested as you're eating gluten. So there's a blood test that you can get it through your regular lab that you normally go to. And this blood test will detect antibodies in your blood to see if you have antibodies against this tissue transglutaminase, which is a antibody in your gut. So if that test is positive, that means you have celiac. Or if you have IgA, that means you have celiac. There's a problem with that test, however. Even if you've been eating gluten, okay, you have to be tested before you go on a gluten-free diet. But even if you've been eating gluten and this test can come up negative. So there's a lot of false negatives with this test. Therefore, in the US, the standard diagnosis, the gold standard for the diagnosis of this disease is the small intestine biopsy. Once you do the biopsy, then you can be diagnosed with the disease. Another way to complement the diagnosis, let's say you have a negative blood test, but you have a positive genetic testing. So there's a genetic test. Your 23andMe will give you some of those results, and your regular lab also. We can order that through a regular lab, but it's the HLA typing. So if you have the HLA genetic mutation DQ2, DQ8, or even DQ7, that means you have a predisposition to have celiac disease. You do not have it, but you have a predisposition to have it. So if you have the genetic test positive and you have a negative blood test, you should still have a biopsy done if you have symptoms. Okay, it's important to know, not just because for you to go on a gluten-free diet, but also to follow up on the progression of the disease. Now, here's an interesting thing, right? 30% of the general population have this genetic mutation. And in some other sources, they even mention 40 to 45% of the general population have this genetic mutation. However, not everyone develops celiac disease due to the genetic mutation alone. So the question becomes, are there other triggers for celiac? Okay. So 1 in about 100 people in the US have celiac disease, have been diagnosed with celiac disease. And about 85% of them, are undiagnosed. About 85% of the US is going around undiagnosed celiac patients. So then the question becomes, other than gluten, is there another trigger? Because I have patients with HLA typing positive that do not have celiac and been eating gluten just fine. Okay. They might have minor symptoms, but not a lot of the abdominal symptoms. And certainly I've actually had patients with with a negative biopsy. So, okay. So we're going to talk about other triggers, but here's a slide that shows you an interesting process of the disease, how it happens. This is a very interesting and important slide to pay attention to. So first thing to know is that gluten, is made from 2 proteins. Okay, so gluten has 2 proteins. One of them is gliadin. All right, so when you eat gluten here, it's broken down in your intestinal wall and enters your gut wall as gliadin. And this gliadin needs to be broken down even further. Okay, but it's hard to do that. So the gluten and gliadin is quite difficult to be broken down in your gut. So what happens is your body has this enzyme called transglutaminase. This enzyme is what helps to break down gliadin. Okay, so once that process happens and those 2 things become a structural compound, so enters the macrophage, and the macrophage, which is a type of white blood cell, presents this combination to the T cell in the body. And if you have, that's the key, if you have the genetic mutation, meaning if the key fits perfectly, meaning the HLA typing, you have the HLA DQ2, DQ7, DQ8, that means the fit is perfect. So the T cell recognizes this as a possible pathogen, as an invader, and it creates an inflammatory response and activate your other inflammatory white blood cells, your B cells and your T cells. And these cells produce an inflammatory response because it wants to take care of a possible invader. So this inflammatory response causes damage to the small intestinal wall, and you go from having all these finger-like structures, the villi, to not have any. And that's a problem here. This is celiac. Okay. So now you have a whole body inflammatory response. Therefore, you can have joint pain, brain fog, muscle pain, all those other symptoms that we talked about. But now you also have a flattening of the small intestine, which now you have low absorption of nutrients. So you see, it's an autoimmune because your immune system fights your body. It starts to destroy your own gut, but it's not an invader. It's just gluten. Another theory is that we might need something else to trigger the disease other than gluten, because, like I said, 30 to 40% of the population have the genetic mutation, but not everyone develops the disease. So this paper is saying that it's possible a viral trigger. You've possibly been exposed to a virus that triggered the disease. So in the paper, they actually show that in order to develop celiac disease, looks like you have to have a specific type of virus invading your system along with gluten in order to have a inflammatory response. You see, they test this. This paper showed that they tested with a different type of virus, and the virus entered the system, damages the intestinal wall, but the body is able to recover. And this specific type of virus, when it enters the system, it seemed to cause some sort of like leaky gut, as you can see here, and then create this whole inflammatory pathway. And now you have, celiac disease. Or they even mention, they talk about gluten intolerance. I wonder if that would be a cause of just gluten intolerance and not necessarily celiac disease. So that's like another factor. So it's known in the medical community that understands celiac that it's possible that we've been exposed. These people have been exposed to something else other than gluten. This is very interesting. So microbial transglutaminase can be a potential player in celiac disease. This paper was published in 2019, Clinical Immunology. So microbial transglutaminase is heavily used in processed food products and are unlabeled. So you do not know if you're eating this thing. What is this? What is this? So remember I showed you in the other slides that we actually have transglutaminase in our bodies, and it's what helps to break down the protein of the gluten. We have that. In the human body, we call that tissue transglutaminase. The food industry, the processed food industry, they actually can make that enzyme from microbes. They have bacteria growing that. And that microbial transglutaminase can seem to be a trigger for celiac disease. So this paper says, okay, so where do they put this stuff? They put that stuff in protein, in basically processed foods, okay, to improve the shelf life and improve the texture. So if you actually Google meat glue, you're going to find how they use this stuff in processed food. So it looks like this could be a trigger. And this other slide here, as you can see, this is the gluten-free society. Okay. So as you can see, they have this, what they call meat glue. See? Microbial transglutaminase. They put that in meat, dairy, processed food, seafood. Restaurants actually use that to make meat, from cheaper types of meat to make it look better, to taste better, to put together. Now you don't know, let's say you're celiac, right? So you're celiac, you diagnosed celiac, you had a biopsy, your doctor told you you're not supposed to be eating gluten. Now you're eating cheese because you think, well, I'm not lactose intolerant, so I should be able to eat cheese. And you're eating this thing that, it's contributing for your illness to get worse, because that's where the antibodies are, right? You make antibodies against that enzyme right there. That's how the test is even done. Because tissue transglutaminase antibodies. So the point being that looks like, the question is, And a question that was raised was, does your immune system respond to this microbial transglutinase as the same way it would respond to your human tissue transglutinase? And it looks like that, yes, that's the case. So I'm going to show you here. There is a paper. So this paper says that microbial transglutaminase is immunogenic and potentially pathogenic in pediatric celiac. So that's concerning. So we know that for celiac patients and for pediatric celiac patients, this meat glue can be definitely a problem. So in summary, looks like there's other triggers. This paper here was published in 2015, and they are actually just going about, different ways of treating celiac disease as far as looking at the whole genetic aspect of the disease. Of course, it makes sense, right? If you have one genetic mutation, what if you have another one that could also be linked to other gut problems? So they put everything in the computer. It was an actual computer analysis, and they were able to see all the genetic mutations here to the right. See that it's actually linked to celiac disease, but that also have been linked to other diseases such as inflammatory bowel disease, diabetes 1, vitiligo, asthma, Crohn's disease. So they're taking a look at this as a whole genetic problem, like a cluster of genetic mutations, because it varies so much from celiac patients to celiac patients. You can have a celiac patient that have a major reaction to minute doses of gluten, and other patients not so much. Per guidelines, 20 parts per billion, it's allowed in the food industry or in medications. And for some celiac patients, that's a major problem because they really react to minute doses. And this might be one of the reasons why, because we might be dealing with other genetic mutations that can affect their response to gluten. The other problem is how to follow up on the diagnosis. Like I said, the gold standard is the biopsy. So we'll do the biopsy, and let's say it's positive, you have celiac. Now you're going to go on the gluten-free diet, and what happens then after that? Oh, your symptoms go away. Oh, that's great, fantastic. But does your gut recover? And how long does it take? Okay, well, let's do another biopsy. So how often? Are you going to do a biopsy every year, every 2 years, every 3 years? So they're trying to find different ways to follow up in the actual gut and see if the villi has recovered or not, because it's important to know if your symptoms go away on a gluten-free diet, that's great. But if you still have flattening of the intestinal villi, that actually can be a problem, because that means chronic disease. That means that your diet is definitely not clean, 100% of gluten, and that can shorten your lifespan. And also celiac has been linked to lymphoma, stomach cancer. So untreated celiac disease, it can be a problem. For that reason, this paper in 2012, they're looking into doing a video capsule endoscopy to evaluate patients with celiac, to basically see the course of the diagnosis, to see, are you getting better? Is intestinal lining getting better or not? So, of course, they're studying the test to make sure that's, very specific, meaning that we can actually rely on this to say, yes, you're getting better. So that's still in study. So in the U.S., as far as I know, they're still using biopsy to follow up. Some patients, I don't think they ever follow up with another biopsy to see if they're doing well or not. So we'll see what comes about that. But this whole concept, it's interesting because what I'm trying to tell you guys is that it's important to know if you feel like you have a gluten intolerance, it's important that you have to be diagnosed to so you'll be able to follow up and pay attention to other symptoms that you might have that might be actually linked to this disease. So that's very important. Thyroid problems, thyroiditis, hypothyroid, all those things also come along with celiac. So if I have a patient with celiac, I'm paying attention to all of these things because I know due to an autoimmune trigger, you can have thyroiditis, which means now you have an endocrinologist, a gastroenterologist, a primary doctor, all kinds of different doctors. And all it is, we need to pay attention to your immune system and how you are responding to gluten or other triggers in your gut. I hope this was helpful. So I'll talk to you guys later.